If you're worried or concerned about human papillomavirus, which is known as HPV, we're going to be answering some frequently asked questions about this virus. HPV is the shortened term for human papillomavirus. This is a common group of viruses of which there are over 100 types. These can be divided into both high-risk and low-risk types. HPV is usually passed on from one person to the next through skin-to-skin contact. For the higher risk forms of HPV, this is usually through any form of sexual contact. There is no treatment for the virus HPV. Usually most viral infections are cleared by the body's immune system within 2 years. However, if the virus does cause abnormal cervical cell changes, warts or cancer, these can usually be treated. The NHS cervical screening programme tests for HPV. This is offered to all women and people with a cervix aged 25 to 64. During a smear test, a small sample of cells is taken from the cervix, and these are tested for HPV. If tested positive, you will be invited for more frequent smear tests or for further investigations if required. There are no blood tests for HPV. HPV is usually asymptomatic. It can live undetected in the body for long periods of time, and around 80% of the population will have it at some point in their life. Therefore, it's usually impossible to know where or when the virus was picked up. No, HPV is not painful. It is usually asymptomatic, therefore you usually will not know that you have it. Different types of HPV affect different parts of the body. The low-risk types of HPV are known to cause common conditions such as warts on the hands, feet and genital area. The higher-risk types of HPV are known to cause cell changes within the body which can sometimes contribute towards cancer. Warts caused by HPV can be spread to different parts of the body. That's why it's important to avoid touching them to avoid further spread. The virus HPV itself does not affect fertility. However, treatment for abnormal cells or cancer of the cervix can make conceiving or pregnancy more difficult. Cold sores are caused by the herpes virus. They're usually small blisters around the mouth area. Herpes is a completely separate virus to HPV. No, HPV and thrush are not linked at all. High-risk HPV is linked to several different types of cancers. These include cervical, anal, penile and oral cancers. However, having HPV does not mean that you will have cancer. The virus HPV itself will not kill you, however, it is linked to some cancers that can be life-threatening. There is no link between HPV and harmful effects towards your baby. However, research in this area is still ongoing. HPV does not usually cause any symptoms. However, some strains will cause warts in men and women. Once your body's immune system has cleared a specific type of HPV, it is unlikely that you will get that strain again. However, there are over 100 different types of HPV, and it is possible for you to pick up multiple different types. In the UK, the HPV vaccine is offered to all 12 and 13-year-olds and people at higher risk of HPV. The vaccine protects against the strains of HPV that are known to cause cancers. It helps protect up to 90% of cervical cancer cases.